All right, let's circle back to this conversation now. In April, the Department of Women, Youth and Persons with Disabilities raised concerns about the economic consequences of teenage pregnancy in the country. Early pregnancy can force many girls to drop out of school, which may come with many challenges. Now, in her capacity as the patron for the Global Alliance to End AIDS in Children, SA's Second Lady, Humile Mashatile, has embarked on a 2-day visit to Cape Town to speak to a number of key individuals, including teenage mothers. She joins us live now. I do hope it is a better line to you. Good evening. When, of course, we will try then to get her on the line for you, just to get a sense of what are some of these conversations, particularly when you think about teenage mothers. How important are they when it comes to this particular conversation? How do we then ensure that the country moves forward, particularly when you think about this issue of a dialogue and looking at the fact that currently the country is still experiencing an estimated 1,000 new HIV infections in children. This calls, of course, for urgent interventions tailored to look at some of these particular challenges. And I do understand that the Second Lady is joining us now on the line. I hope it is a better line this evening. Thank you so much for your time. When one looks at the vision, for example, of the Alliance, there does seem to be significant progress that has been made in some of the countries to provide antiretroviral therapy to pregnant women living with HIV. But when you look at, some of what is contained there does seem to be a need to move with speed to end new HIV infections in children. Why was it important for you to take up this cause?
Thank you so much. Apologies for the connectivity. Yes, I think we've realized that as South Africa, there is a huge gap within our country, because we realize that there's more than 270,000 children. That's the number of children living with HIV in South Africa. Now, that is the largest number of children living with HIV in the world. And so over 70,000 of those children are not even on treatment. This is where the injustice and where the gap is, as to where we decide to get involved with Global Alliance, as to how do we breach the gap. So my interaction today in the Western Cape with the various young mothers, as well as various stakeholders, to understand as to how are we able to eliminate and actually decrease HIV infections, as well as educating our young mothers with regards to syphilis, hepatitis B, and of course minimizing the vertical vertical transmission of HIV/AIDS.
And when you look at, the teenage mothers, as well as you've alluded to, some of the conversations you've had with them, let's talk about the critical involvement in this and also some of the conversations you would have had with them.
It was very intriguing 2 days, actually, because yesterday when Richard's playing, of course, we were involved with, talking to civil society forums, mothers as well as their children. And some of the issues that they're having is that even when it comes to going to our healthcare systems, our clinics, the nurses are not receptive and they're not able to get the necessary treatment, or rather they're still stigmatized when they do go to hospitals. And of course, when it comes to poverty and GBV, so those are the most prevalent issues that we see were forthcoming within these young children. And of course, interacting with their parents as well. The parents also need to be educated when it comes to teenage pregnancy and supporting their children when it comes to seeing that they're able to go to hospital, get the necessary treatment and emotional, together with psychological support that we need to do together with the communities. So one thing that I picked up is that most of these young mothers, they need support from our healthcare system, from our government, including financial support. So we're really reaching out to various stakeholders and funders to see how they can be able to continue with their education. Outside of having a child, they should be able to continue further their education, complete their education, and pursue their tertiary education as well. So those are the issues that we need funding at Global Alliance. And together with the various agencies as to how to ensure that we support these children into ensuring that they meet their dreams as well.
And the element of support is quite critical, especially as you talk about the fact that, when we think about, teenage mothers, a number of times it comes with them having to drop out of school. And in some cases, others are able to return to school with the necessary support, be able to complete their schooling and then, have a better life for themselves. And I suppose that's where, listening to you, the element of parents as well as communities become critical in order to ensure that we don't lose girl children, especially in our schooling system and in our economic activity.
Absolutely. I think there has been, of course, there were two issues which were actually quite touching, where a young mother indicated that the money that she received from the father of the child was with the mother, and the mother was not able, had left her with the small baby, including her own child. So these are the issues, community issues, that we need to address together with the educators as well as healthcare systems, so that these children come back to school. And this we cannot do alone, unfortunately. It's a holistic collaboration with the entire community and educators as well, because they also tend not to know how to be able to interact and direct these children to the necessary health facilities.
Yeah.
So having social workers within the schooling environment can assist us so that the kids can be able to provide that support outside of going to the healthcare system. Because we must understand, most of these kids are at school between 8 and 3 o'clock, Monday to Friday. Some of them are not able to go to clinics or hospitals within those periods. So having a social worker or psychologist, somebody who can be able to direct them appropriately within the schooling system and monitor when the child has given birth, and that they're able to have a mix of prenatal care and postnatal care and actually go back to school in order to complete the education.
And I suppose it also speaks to the issue of strengthening support systems, for example, for children living with HIV in the country, in order to ensure that they work effectively.
Absolutely. And, I think the one issue that we also need to highlight is that GBV and discrimination has been another issue that we realize that these children are discriminated against and they're stigmatized amongst their friends, amongst their peers. So we still need to educate and provide awareness around educating our children with regards to HIV and AIDS, so that it's not stigmatized, because, of course, we're able to provide them an excellent health system when it comes to providing the necessary health care. However, it is for us not to stigmatize it, so that our children can be able to go to the hospitals and have the necessary medication and treatment that they need in order for them to improve their lifestyle and health as well.
Yeah, and it really is an important, it's important work that you have undertaken there, and a number of these stakeholders, because it's important to deal with this issue of GBV and discrimination, as well as the stigmatization of these particular young individuals. And do hope then we'll circle back to this conversation to see how the work is progressing. Thank you so much for your time. Do appreciate it this evening. That was Humile Mashatile, patron of the Global Alliance to End AIDS in Children and South Africa's Second Lady.